Your shoulder bursitis is a symptom and not a diagnosis. And important in the recovery of your shoulder bursitis is working out what the underlying cause is and addressing these underlying elements. A shoulder bursitis can occur for two main reasons. In a small percentage, you can have a traumatic shoulder bursitis. This can be caused by a fall onto an arm, a fall onto the tip of the shoulder. However, in most cases, a shoulder bursitis is a symptom of an underlying rotator cuff tendinopathy. A rotator cuff tendinopathy is a gradual weakening of your rotator cuff tendons. The tendons are what attach your rotator cuff muscles to the bone, and the tendons function to stabilize your humeral head in the socket during your movements. So if there is a weakening through these tendons and the humeral head is not stabilized as effectively as previously, it can irritate structures such as the subacromial bursa. Your symptoms of a subacromial bursitis are typically an inability to lay on that arm. We have night pain, and there can also be quite a severe pinch and pain in the tip of the shoulder, which can often radiate down the arm with flexion movements and abduction movements, especially at about 90 degrees. This pain often goes away as we clear that 90-degree element, and then it can pinch on the way back down. We call that a painful arc. The treatment of a subacromial bursitis requires two phases. The first is the calming down of symptoms. So we can do this by alleviating tensile and compressive loads going through the shoulder. Our tensile load comes from our muscles being super tight, whereas our compressive loads come from the shoulder being in positions that push that tendon up against the bone. So for example, having a rounded shoulder posture or laying on that side can put compressive load onto the shoulder and aggravate your pain. The symptom relief stage of treatment requires activity modification, often some hands-on therapies such as dry needling, remedial massage or joint mobilization. However, it must be noted that even though these modalities can improve your shoulder bursitis symptoms, they will not take it away completely. The treatment of the underlying tendinopathy requires a strengthening protocol. Often this begins with strengthening up of our mid-back muscles and the muscles that will stabilize the shoulder blade effectively down and back. Taking your shoulder into this down and back position again can reduce those compressive loads that go through your rotator cuff tendons. After you've effectively recruited these muscles, we want to get you stronger with your pull and push movements. These pull and push movements are often more effective at strengthening your rotator cuff tendons compared to your classic external rotation, internal rotation exercises that you see people doing in the gym. After this, you want to gradually expose your shoulder into overhead ranges of motion.